Ashley Rossi, and my husband Kyle will be interviewing me on the importance of diversity in family therapy.
Why is it important for therapists to be sensitive to diversity?
I think that it is very important for therapists to have a sensitivity towards diversity. I think that it fosters a positive environment that leads to successful growth in therapy. Our society is more diverse today than it has ever been, and the traditional family is constantly evolving. And therapists need to be prepared for culturally dynamic couples and families. Blended families are more and more common today, as well as same sex couples and intercultural families. And as therapists, there will be many times that we encounter clients that in which we have substantial differences from. And in order for therapy to be effective, it is crucial for us to be able to demonstrate sensitivity towards our clients and avoid stereotyping them. I also think that having a sensitivity towards diversity also helps minimize the risk of misunderstanding and misinterpreting our clients. For example, if we have a couple come in for couples therapy and they come from a culture where it's a sign of disrespect for the woman to look her husband in the eye, if we don't have a sensitivity or an awareness of their culture, we might misinterpret that as we might misinterpret that and think that the man must be abusive or he's domineering, when in fact it's just a simple part of their culture, and it doesn't have a significant meaning. That sensitivity, having that sensitivity towards diversity, will help us so that we don't make those mistakes as therapists. I also think that it's important for us to acknowledge the influence of culture and respond respectively to differences in values and beliefs. I also think that we I also think that having a sensitivity towards diversity helps us build a relationship of trust with our clients, and respecting cultural boundaries also allows us the opportunity to gain a deeper level of understanding of our clients. We know that race and ethnicity and our cultures are key to understanding individuals, and the changing demographics of our society make it extremely important for us to not only be aware of cultural differences, but to be knowledgeable about other cultures. Um,
Will you give an example describing a worst case scenario when a therapist is untrained or not understanding to family diversity?
yes, first of all, I think that many things can and will go wrong when a therapist is not trained or they do not have an adequate understanding of family diversity. I think that the worst thing that can happen is a therapist hindering the therapeutic process altogether. And as a result, an individual or family may leave therapy before they receive the help that they desperately need. I also think that a negative experience with a therapist that doesn't respect cultural boundaries can also cause an individual or family to never seek therapy. They may think that all therapists are trained this way or all therapists think that way. So they may never attempt therapy again. And therapists also miss out on the opportunity to develop and establish a relationship of trust with their clients, and they also miss out on the opportunity to gain a deep understanding of their clients because they don't have a sensitivity towards their cultural differences. An example of a worst case scenario would be a therapist may have a client with whom she has substantial differences with, and the client might be from a collectivist culture where the therapist comes from a more individualistic culture with different beliefs. And the client might come in because they're depressed in they're depressed because they're unhappy with their current career choice. The client is attending medical school because that is what her mother and father wanted her to do, and this has caused her great grief. So she comes to see a therapist for help, and because the therapist doesn't have a respect for the client's cultural differences, she might tell her that at her age that she should be making her own decisions about her career choice, and that she shouldn't care about what her parents think or say. And so she may even invite her parents to attend a counseling session, and the therapist again doesn't have any training in this area, so when her parents show up to the next counseling session, she immediately confronts the mother and father and tries to explain to them that her daughter at her age should be making her own decisions, and she should be, allowed to pick a different career. And the parent, this might really offend the mother and father, and had she had an understanding of family diversity and had training in family diversity, she might have handled the session with her parents completely different. But because she didn't, the mother and father end up leaving the therapy session highly offended and even more in conflict with their daughter than they were prior to the session. And later on, when the daughter no longer comes to therapy, the therapist is left feeling confused, and she doesn't understand why the daughter severed their relationship. And I think that this would have been handled completely different if she would have had training in family diversity, or even an adequate understanding of this client's culture. And things might have been handled differently, and she might have been able to foster a relationship with the parents. And I think that instead it did not end well, and I think that this would be a worst case scenario for when a therapist is untrained in family diversity.
Can you articulate your plan to maintain your professional awareness and education on family diversity?
My plan to maintain my professionalism regarding family diversity is simple. My goal is to be a successful therapist. I want to help families, therefore I need to be well prepared to help all families, and this includes families from different backgrounds, different cultures, with different beliefs and value systems. I know that the world we live in today will not be the same next year, 5 years from now, or even 10 years from now. I have to adapt to our changing society and evolving family systems. In order to maintain my professional awareness and education on family diversity, I must also continue my professional education. With such a dynamic career field, I should attend seminars and conferences to ensure that I am conducting treatment using the most up-to-date methods and techniques. I will also continue to take professional courses in multicultural topics, and I will also communicate with fellow therapists to learn from their past experiences and backgrounds. Above all, I think that the most important thing that I can do to maintain my professional awareness and education of family diversity is to maintain an extensive professional network. Our technology today allows us to communicate instantly with people from all over the world, and this provides us with many opportunities to communicate with therapists around the globe. These therapist can offer insight and advice when dealing with clients that are from different cultures, um, and being able to communicate like this will help me maintain a professional awareness on family diversity.